Yeah, that would be awesome if you could.
Okay,
Thank you
so
so much.
it is now recording. Do I have
Okay.
your permission?
Yes, you do. My consent.
Thank
Thank
you.
Okay, so just to start off, if you're comfortable, if you could briefly explain how you acquired your brain injury and how long ago.
Yes. Okay, so I have a repetitive electrical injury. It was 450 volts, 900 milliamps,
Right.
116 times. Um, because it was repetitive, it happened over a lengthy period of time. My first treatment was in December of 2002. No, yeah, 2002. And then I finished the first half in February or maybe January of 2004.
Right.
And then 3 years later, in 2007, I think it was the summer or fall of 2007, I started again. And I had it until 2009. I quit against medical advice in June or May or June. Um, and the treatment course was 3 times a week, 3 times a week, twice a week, once a week, repeat over and over and over again.
Right.
So, um, it there's two parts of electrical injury. Evidently, there's the initial repercussions, which initially caused memory loss, and as my brain began to heal, the memory loss actually became more dense and more pervasive. So like immediately after, during the very first part of ECT, I still talk about memories that I had. Um, but then as the treatments progressed, it has what's called a cumulative effect because it's a repetitive head injury. And so my memory slowly deteriorated until when I quit ECT against medical advice in 2009, I actually quit in part because I could no longer remember my parents and family members' faces when I was talking to them on the phone, even when they had just dropped me off somewhere or something. I don't know, I couldn't remember their personalities. I just had in my phone that was their number.
Right. You
So
just noticed those little changes in your memory, I'm sure.
yeah, and it wasn't just memory. I mean, memory obviously is a large component because when you erase 36 years of your life, that's erasing your entire identity. Because
Right.
it's not just like you forgot it and then something will trigger a memory. It really is gone.
Yeah.
Um, so it's kind of strange to like read my journals, which I'm very grateful. I wrote a lot, but I can tell it's in a handwriting that's probably mine, at least the voice that's mine. Um, but it doesn't trigger memories. Same with looking at pictures of things. I have to kind of play Where's Waldo to find myself.
Right.
And it's difficult because when you think about all of your interpersonal relationships, they're established on shared memories. And then if you no longer have those memories, there's an imbalance in the relationship. You feel very isolated and disconnected from those around you, even if they know you. But
Yeah.
worse than the memory, I think, was the functional impairments. I began reading when I was 3 years old. I was reading at a third or fourth grade level by the time I was in kindergarten.
Wow. It's
Yeah.
impressive.
So I I was an editor for faculty papers when
Sorry. My dog barking.
he's like, Mom, I'm here.
I know, Mago, come here. What are you barking at?
I was editor of faculty papers when I was at at BYU for the
I'm sorry, I'm
humanities
just gonna put him
department.
outside really quick.
Okay. Okay. So I was editing faculty papers for the humanities department before they submitted them for publication.
Wow.
After ECT, I had no memory of my education. I had no memory of my coursework, my experiences in college, and none of my work experience. And so I realized that the only way I was going to be able to move forward in life would be to go back to school. Because at that point, my only skills were basically answering the phone because I can talk. So I had always wanted to work with people with disability, and my journal said that I knew I had been an interpreter for the deaf because I still had friends that would tell me that I had interpreted for them.
Oh, wow.
And they were very upset actually that I couldn't remember the language. They worked really hard with me to help me relearn it. And I had friends that spoke Spanish that also helped me relearn Spanish. And then I chose to study for the GRE a year and a half after ECT. I sat for the GRE and I bombed it. I studied so hard for that thing. I can't even tell you. I had flashcards. I had written everything out. My problem was that my vision was impacted, so letters would move when it was like on a computer screen, and they didn't make words. They just kind of moved. And when I was reading, I had to read like highlighted verse, where it highlighted the words as I was reading. And I had to use like a jig that had a hole cut out in the paper so I could track the line that I was on.
Right.
That was problematic though, because I'd read a line and then I couldn't remember what I just read to read the next line. That's why I had to use the jig to read, and then, okay, this is the next line, but I couldn't remember what I just read to read them anyway. It was a choice.
Yeah, and it's such an extensive test too.
It really is. And I was laughing because even though I had studied for probably 6 to 9 months for the vocabulary on that test, I scored in the bottom third percentile.
Oh no.
Yeah. And so when I went to meet Karen for my interview, I was just like,
yeah.
you know.
Let me explain myself.
Well, no, I honestly just thought she would laugh at me because here I was trying to come to school, verified schizophrenic according to my health records. I had just broken out of the institution where everyone laughed at me for wanting to get my master's degree and told me I never could. And then I bombed the GRE after studying for 6 to 9 months. And I was like, this is just a pipe dream, but I'm gonna keep trying.
Oh, good.
Yeah, and Karen looked at my transcripts and she's like, well, if your brain is as good as it used to be, you have exceptional grades. I was like, yeah, I was a research assistant and I did faculty papers and I write. She's like, well, writing is probably the most important skill in grad school.
Right, yes.
Yeah.
Typing.
So I had to relearn how to type. Oh gosh.
Yeah, that can be difficult.
Yeah, but it
I,
was exciting, and I wouldn't have survived in another program. But I had faculty that understood disability. They brainstormed strategies with me. They helped me learn assistive technology to learn what kinds of accommodations I needed. I was able to get tested because my doctors were refusing assessments, and finally I said, I'm in school, and the only way to get accommodations, academic accommodations, is to prove that I actually need them. So I don't care when you say I don't have a brain injury. I need proof that I don't.
right,
Because I have some learning differences that can be supported with academic accommodations. And
right,
so then, because I was already enrolled, my psychiatrist was like, well, that makes sense. Okay, I will refer you.
oh, good.
But I have friends that I've met online who have never had that opportunity to have the testing done
Oh, yeah.
because
And
their
that's such
doctors just refuse it.
yeah, and we kind of talked about this in Chuck's class about how the problems kind of matriculate with each other. It's like the biggest problem is
Yeah.
funding. Okay, well, when you have a hard time getting diagnoses, you can't get funding. You can't get
No.
you need proof.
Yeah.
And when they
Yeah.
refuse to provide that to you, what are you supposed to do?
What are you supposed to do? That's exactly the problem. Yeah, and especially in terms of electrical injury caused by a doctor,
Yeah.
there's no doctor in his right mind that's going to or refer you for an assessment to rat out his colleague.
Right. Right. And that's kind of something I talked with Chuck's class about too. We were talking about how the ABI program provides the brain anatomy classes for their clients and even their families just to raise awareness about how the brain works and to get you to ask better questions. And
Yeah.
I was telling Chuck, I'm like, sometimes I hear that even when they do learn the right questions to ask, sometimes doctors don't like that.
No, they don't.
Feel like they might know more than them or they're,
Yeah.
being smart. But
Yeah.
it's just trying to raise your own awareness about your disability, and there's just not enough professional specific help out there, I don't think.
No, there isn't, unfortunately. It's not very well understood. Brain injury is not very well understood.
Oh no.
Electrical injury is not very well understood.
That's a whole other ballpark, I feel like.
Yeah, like on the call, the reason I would recommend doing the call is because the board meeting, guess who is on the board meeting?
Who?
Dr. Bennett Amalu.
Oh, really?
Yeah, like
Really?
seriously.
Awesome. Yeah.
So it's like it gives you the opportunity to really rub shoulders or earbuds with with other professionals that are very highly regarded in the field.
Right.
Gives you the
Yeah, that
opportunity to be on the forefront of what's going on.
kind of make your voice heard too.
Yeah, exactly. That's why I'm doing it.
So,
Because
so
there's so many people who need help with
oh
electrical injury. 2 million people a year internationally, that was estimated in 2004. And since then, they've reclassified the device and made it possible for kids 13 and older to get it.
gosh, that's so young.
Yeah, I know. I mean, I had this done to me when I was in my 20s and 30s. Can you imagine? I'm having the delayed electrical injury is very common, even when it's
Yeah.
done correctly. And so I started having problems when I was 43. My friend, he actually only had 13 treatments and he feels it saved his life, but he's now 56, I think he said, and now he's starting to experience episodic problems with swallowing, which is how mine started. He
Yeah,
only had
I was gonna
13.
say. yours was delayed, right? I think
Yeah,
I remember you saying it had
yeah.
been 10 years.
It was 7.5. Yeah. There's two parts of electrical injury. There's the initial injury, and then because it causes gliosis, myelin sheath damaging, microhemorrhaging, cerebral vascular weaknesses, then as you age, you get lesions, you get myelin sheath
The
damage.
delayed responses.
Yeah, it's you don't age gracefully with this kind of injuries. Just like football players, they don't
Yeah.
age gracefully.
Yeah, the mind deteriorates. Sometimes it can, like you said, happen quickly, but
Yeah,
sometimes it just, like you said, the aging process, and that especially doesn't make it easier because the older you get, I mean, the more likely you are to occur a disability. But
it's true. And it's difficult for people with brain injuries because, especially for people with the electrical injury, it's because there is the second half of the injury is delayed. It makes it difficult to track because
right.
people are never tracked for longer than they leave the hospital unless they're in a singular clinical trial that took place in 2007. They tracked people for 6 months.
Yeah.
That's it.
Yeah, it's so hard to keep track too, because the amount of people that you have to see throughout,
Oh
a
yeah.
day.
Oh yeah. Oh yeah.
So
Well,
with that being said, when you had your initial delayed responses, I know you had mentioned when we originally met how that impacted your life greatly, and you had expressed to me and Kurt that doctors were saying that you shouldn't even be alive.
yeah.
Um, what were after you were, I guess, rehabilitated? Um, what were your initial feelings? Did you feel like you were pretty knowledgeable on the resources, or did you kind of have that sense of feeling lost?
Well, when I very first came out of graduate school, I had the opportunity to do basically 3 years of intensive rehabilitation
Oh,
because
wow.
it was forcing me to learn my resources, forcing me to get accommodations to learn to reread, to learn to manage my time. Like I'm grade oriented. So I was like, it was really forcing me to become structured in a way that my brain just really honestly wasn't capable of doing for the first 2.5 years of school. And
Right.
so once I finished, I was like, oh, this is awesome. I finished and I didn't know about delayed electrical injury. So I just figured that I would go forward, go on, get my doctorate, keep going.
Right.
And I was invited to teach with Marge, and I taught for 4 years. And um, I started having the intermittent problems with swallowing, and I started having the really strange, like, we didn't know it at the time, but we're beginning to suspect that it's autonomic seizures, and also brainstem type seizures, and also they're seizures that are based on your electrolyte levels. So they're called. I've developed evidently electrical injury is uh, connected to what's called channelopathies, which is how your body uh, manages electrolytes and ion channels. Um, I don't know, but we didn't understand. Oh, just a second.
That's okay.
Oh, my husband wants me to get something off the porch. One moment, please.
Okay.
I just, let's see. Yeah. So, where was I?
You were kind of just explaining the initial feeling after you started teaching with Marge.
Oh, yeah. And I started having all of these really strange symptoms that we couldn't understand. And what I didn't know is that these channelopathies begin to progress and deteriorate. And as they do, you become more sensitive to your environment, allergies and such. And I was working in a building that was very moldy. And so every time I went in, my body would just go into acute problems. And I'd have these really gnarly contractures, and my voice would get even worse than this. And Marge was like, "What's going on with you?" And it was embarrassing. I didn't know, and none of my doctors knew.
Right.
Let me just let my sweetie know that I finished that. Okay, and so then it became a quest, because it was episodic and it was very confusing because we didn't know what was going on. And finally, I connected with a trauma nurse who also had ECT, and she's in her late 50s now, and she said, "Sarah, now you've graduated to delayed electrical injury." And I was like, "What the freak is that?"
Yeah.
So she encouraged me to begin researching the delayed electrical injury. And so I started in researching that, and it causes problems with motor neuron disease. It's associated with Parkinson's. It's associated with all these acute allergic problems and neuro weirdness. And I'm just like, oh snap, what did I get myself into? But
yeah, I mean, hearing about TBIs is already so little. Hearing about the electrical response is probably pretty unheard of to most people.
Well, and I thought I was out of the woods. I mean, we're talking 7 years after my brain injury.
Right.
I was on the way to getting better. My reading speed was improving, my reading comprehension was improving, my ability to create new memories had come back. But it was weird because it's like I had improvement, and now I'm experiencing all the symptoms of early onset dementia, and I'm only 45. I'm like, seriously? So in May, next month, I'm gonna be assessed for dementia. But it will be the 9th neurologist I've been to in the past 2 years.
I know you mentioned you've had a lot of trouble with that, finding a good neurologist.
It's been so hard because it's outside of the scope of practice, they say.
Right.
It's no one specializes in electrical injury unless they're in Chicago or Denver.
Yep.
And so we finally had to contact them.
Oh, wow.
I got into the delayed electrical injury research and started contacting all of those researchers.
Right.
And the majority of them wanted nothing to do with me because initially I was saying that I had a history of shock treatments. Nobody wants to talk to a psych patient. So then I would just send a message that I had a history of being adjunct faculty at San Diego State University, and I was a rehabilitation counselor interested in providing better rehabilitative care for people with electrical injury. Then I started getting some response.
I guess you gotta let them know you're there. People are just so biased.
Nobody, no one can do that. None of my peers can have those qualifications. And they're seriously suiciding because they have no hope. They don't know what's going on. Their doctors are just saying it's in their head. They're just malingering. And So I've been gradually working with these researchers to identify the appropriate assessments for electrical injury. And that's what I want to do for rehabilitation is I want to have like a pamphlet for rehab counselors who work with uh, clients that have a history of mental illness. On their intake form, it needs to say, have you had ECT?
Right.
Because it's an entirely different assessment process for brain injury than just mental illness. They're going to go in there with their primary diagnosis as a psych illness. Maybe it is, but their secondary diagnosis, if not their primary, depending on which one's more impactful, will be their brain injury.
Right.
And immediately after treatment, it'd probably be the primary diagnosis, and maybe 5 to 10 years after treatment, it would again, if it had shifted, it would become the primary diagnosis.
Yeah.
But
It takes over your life. I mean, we should be
yeah,
being informed on all of these things.
yeah. And
So with that being said, in your experiences, do you feel there is a disconnect? Do you feel that lack of resources within this community?
oh my gosh, there's such a lack of resources. I am literally being the resource finder for my entire community.
Right.
Every time I find a test or a blood test or a brain type of scan, either a VNG, which is a video nystagmography, or when we finally connected with the neurologist in Denver that recommended the 3T MRI with SWI. I mean, the standard neurologist evidently doesn't know how to even write an order for that they would think it would be important for someone with electrical injury. And it's just, I share these with my counterparts and their family members that are in the Facebook group, and they can't stop praising me as if I've done something magical. But it's because they're all so desperate for proper assessment and for proper help and support. There is nothing out there for them. There's a one article that was published in 2008 in Ireland that said that people with a history of ECT need to have rehabilitation for brain injury. And
Yeah.
primarily focused on memory, but there's so much more to it. I mean, we're running into walls because our depth perception is off. Like even yesterday I burned myself, or 2 days ago I burned myself because I took something out of the oven, took my gloves off and forgot that it was hot and grabbed it. So it's just like, I mean, people, they say, oh, it's just memory loss. No, working memory is pretty profound. Like you use working memory for everything. And
Right.
your executive functioning, I mean, impaired executive functioning, like we're talking plan and prepare, that's the only way you can be independent, paying your bills, budgeting your funds, showing up to class.
Yeah.
Being, I have problems tracking time, and I feel bad in my grad program because people would be like, I would show up late to everything. And it wasn't until my awesome AT class wrote an entire grant proposal with research for me to get an iPad that could set up like a calendar with alarms. I mean, my AT class did that for me.
Yeah. Yeah.
My friends don't have AT friends. They don't have graduate students interested in them. There's 2 million people that don't. And that's 2 million people every year. So there's lots of people in 80 years of use that have this injury. And I'm blessed because I'm getting the help that I need, and I hope that I'm paving the way for other people to find these resources because there is such a disconnect. It shouldn't be on the brain injured patient to find their resources.
Right.
And to
I
be,
think,
everyone's like, well, you have to be an advocate. Well, I'm sorry, advocacy requires brain function and an executive functioning. So if you can't constantly follow up on everyone, you know,
right.
it's impossible.
It's hard. It's hard, especially when you're trying to adjust your
Very hard.
own life. It's like, how can I focus on others right now when I'm
Yeah.
trying to get my life on track?
Yeah, that's why I don't focus on others, but every time I get something, then I share it with them and then they
Right.
can use it.
You
But
just
like,
share your wealth of knowledge, and that's
yeah,
advocating yourself. I
yeah,
mean,
yeah.
you're doing something to contribute.
I'm trying to like write stuff up, but I've gotten to the point that like I can tweet because it's just like 20 characters or whatever.
Right.
But putting things in a cohesive like paragraph, it's like I'm forgetting how to do it. And so I have my mind map, you know, that I learned about in AT, but it's like it's a very laborious process that shouldn't take as long as it does. So I'm not getting all the stuff written that I always thought I would.
Yeah, I think what I've come to learn, I haven't had much experience within the TBI community until I started interning at the Brain Injury Foundation. And
Yeah.
right away, I just caught on how little we're taught about it, even in our program
Yeah.
that tends to people with disabilities, a variety of disabilities. That just people don't really realize, and I was included in that population that just don't realize how affected or how a life can be impacted so greatly
Yeah.
and for the rest of their lives. I mean, you're talking about symptoms that can either re-hospitalize an individual or just put them in a financial situation that they can't handle.
Yeah.
You're talking about people, like you said, in social isolation. You're talking about losing an identity and being able to do the things that make you you.
Yeah.
I mean,
And that, I mean, anytime anyone gets an acquired disability, they need to be walked through a grieving process.
right,
And
right. And that's what I'm trying to focus on with my paper. There's no transition period for individuals who suffer traumatic brain injury. I mean,
you know,
basically getting them into the hospital, making sure they're, well enough to go back into whatever their home care, or
yeah.
I've been learning that some people go to nursing homes at young ages, and
Yeah.
that to me is awful.
Oh
It's
yeah.
not a way to be treated after,
No.
experiencing that. And I mean, you can develop other disabilities from that, like
Seriously.
depression and anxiety and
PTSD.
dependency on alcohol or drugs.
Oh
And
yeah.
it just, it's from what Kurt was telling me, there's more people a year that experience traumatic brain injuries than heart attacks and cancer combined.
Yeah.
And to me, that was just shocking, because to not have the funding there for such a common disability is
Oh yeah.
something
Outrageous. Outrageous. I mean, you think of the strokes, the aneurysms, the car accidents, the ski accidents, sporting accidents.
Yeah, whatever it may be. I mean,
There's so many different ways to injure your brain.
and I think the problem is it's just a lot of people, I feel like, with how fast-paced life is nowadays in America, it can just be a very one-sided mindset where it's like, well, that won't happen to me, that could never happen to me. And then when it does happen, it's like, what do I do now?
Yeah, yeah.
What do I do now?
And I think also it's such a situation where, because we are so distracted with so many things, we forget that there are people around us that are humans struggling to live with humanity. Brain injury, by its very nature, causes problems with personality, explosive emotions, disability, difficulty regulating emotions, and that right there puts you in a situation where soft skills can be very compromised.
Oh yeah. Your whole life has changed by just
Yeah.
those two things.
And so people in general have a hard time putting up with difficult people.
Oh yeah.
And so you put a population that becomes more difficult because of a brain injury. And it's like, it's difficult for them because funding isn't there, likely because there aren't very many people who are in situations where they are still friendly after a brain injury.
Yeah. Or able to advocate like you were
Oh
talking
yeah.
about.
Oh yeah.
So, since I have moved to San Diego, I really realized how progressive of an area it is as far as, it's got a lot of resources for a variety of disabilities and
Oh yeah.
ABI included. So on your take, I wanted to see what you felt might be the resource you most benefited from. Sorry, hyper right now.
Yeah.
What resource do you feel like you maybe have benefited from the most in San Diego?
In San Diego, I would probably definitely say the ABI program because it gave me social outlet. It gave
Right.
me, I mean, I was just getting such cabin fever in my house, not
Yeah.
able to leave, not able to drive anymore. And it was getting to the point I was about ready to crawl the walls. I was just like ready to scream. And so I was grateful when you and Kurt came in and did the interview. And I was grateful for the little paper that Kurt drew up and sent me that had resources in it. I was very grateful that he connected me with the peer support network because I think they have good intentions. They probably need more help with coordinating with their volunteers. But I've had someone visit me probably about twice a month since then.
Oh, good.
Yeah, get me out of the house, get me communicating with people. Even now, one of their kids is like doing art projects with me once a week on Zoom.
That's so cute.
So
You've got
cute.
art classes then.
Little 13-year-old is teaching me how to draw. And she's so precious because I'm losing my hand coordination. And so she's like, "Oh yeah, you're doing good."
Hey, art is abstract, right?
Yeah, exactly. So it was really, really funny. I think it's hard to find a good balance between resources for brain injury, especially because brain injuries can evolve.
Right.
People can, it's a very slow process, they can get better. Like aneurysm, I know my cousin had a brain aneurysm, and it took him about 2 years to kind of get back, like, kind of a semblance of normal.
Right.
He's not the same where he was before, but he is able to do a lot more than he was.
Right.
And he feels he's probably gotten to, he hasn't really improved much since the 2 years after the aneurysm. But he's not having a deterioration, after the fact. So there are people who will have, progression towards goodness, and they will just keep getting better. Even though it's slow, they'll see it. Then there are other people who won't and who might even get worse, like me. I think one of the things that frustrates me the most is the evolving need of resources. Like previously, I didn't need transportation resources. I didn't need AAC device.
Right.
now I'm starting to have to, now I'm having periodic problems with extreme verbal apraxia where I just completely become nonverbal. And that would happen once in a while for like over the past 18 months, but in the past 6 months, it's become probably 3 or 4 times a week. So people with brain injury, it's like you kind of need a social worker assigned to you who can track you and like check in with you and see how you're doing. And honestly, I would kind of ideally put it in the context of like telecare for psychiatric patients. I was a telecare patient. I had someone assigned to me who was basically like a care coordinator who would check in and see if I was going to my doctorate appointment, see if I was taking my medicine, see if I needed anything resource-wise. And I really think that there needs to be a program kind of like telecare for people with brain injury because our needs do evolve. And there's so many resources that suddenly become available that nobody knew about, and they're hidden resources, little gems. So
well, I had been reading a little bit about that and what could help individuals when leaving, the transition period, and not only that, but the funding. And the most common thing I was starting to see was we need to have case management implemented into the acute process and the acute care. Because how do you expect somebody to not only adjust to their new life, but find all these resources and opportunities on their own? There's no way. And then you're putting that responsibility on loved ones who also might take a lot more responsibility than just that. I mean, they're taking care of their loved one.
Exactly.
Their life is changing as well.
Exactly. And it's hard because it's not like someone like me, I never went through acute care. So I would never be funneled into that. So it's just like, it's difficult because how do you capture the demographic appropriately?
Right.
How do you funnel them towards services? But having a case manager, once you get into it, honestly, if we could somehow create like a Lannerman Act like they did for developmental disabilities to create the regional center.
Right.
If we can do like something like that for acquired brain injury,
it would be changing the world.
It would be life-changing, yeah. Then you could, like, even if they, like, the regional center could have the developmental disabilities, and then maybe we can, like, pass some legislation to have the acquired.
There you go.
They could have different levels of care. Like initially, I needed someone checking in with me weekly, but then for probably about 6 years, I was doing great. So they could have backed off care, for maybe quarterly even. But then as I began having problems, then now a weekly visit would be very welcome. Especially during something like this where I'm running out of soap, I'm running out of shampoo, and can't get to the store, it's just like,
I mean, I think there's some moves that the community needs to be making. And I had mentioned how it can also be hard on the family as well. And I know that's something we talked about when we had originally met up about how your parents were helping you out. And I think Kurt and I referred you guys to the Southern Caregiver Resource Center.
Oh, I forgot.
No, it's okay. I was just wondering if you guys had used that or how.
No, I totally forgot. That's actually wise. If I could get that information again, I'll reach out to them. I'm in a situation now where my husband makes just over the limit for Medicare or Medi-Cal. So I cannot qualify for Medi-Cal. which is hard because I'm getting to the point that I need help around the house and I need help
Right.
during the day. You were there for one of my episodes, and those have happened probably about 2 or 3 times a month with increasing frequency.
That's
Um,
pretty exhausting. I mean,
yeah. So I do have a friend who's uh also is a housekeeper, and I started trying to pay her for 4 hours a week, but yours truly, with her brain injury, cannot budget her money. And so I also had a big Costco run, and then my check bounced for my
oh,
friend. So it's like, balance the toilet paper and paper towels with your housekeeping, you know.
yeah, it's just it makes me sick to my stomach hearing stories like that put
Yeah,
people in situations where it's like, okay, do I afford, help around the house that I need, or
yeah.
necessities like toilet paper and soap? It's like nobody should have to choose between those two things.
No, like my friend comes and she helps me like chop up vegetables and put them in the freezer or put them in the refrigerator so that I can cook around the house.
Oh,
But
good.
my occupational therapist just commanded me never to cook again, especially after the burn. And this is not the first time this is happening, but I'm just like, oh, am I just supposed to sit by myself here and just stare at the walls when I get hungry? I mean, seriously,
Right.
so it's frustrating. And
Yeah.
I know that I am very blessed because I have a family who understands me, or at least they're trying to. And I have a family who has financial means. And I mean, my family has subsidized this house. We're paying subsidized rent for this house.
Right.
So I am in a situation most people do not have the benefit of being in.
Yeah. I recently actually learned that Illinois, I mean, I think 15 states that do something, it's called the Medicaid waiver, and it's a TBI waiver that provides some sort of funding for you to choose what you do with it. It's pretty much like a what's it called? Self dependency program, or, where you're able to make your own decisions.
Wow.
And yeah, they give the funding to them, and they can get in-home care, and your family or friends qualifies for that, so then that way you can pay them.
Oh, wow.
So, but see, that's the problem is, like, I was talking to Chuck, it's like not fair that somebody should have to just pick up their life and move because they don't have the resources and where they're
Yeah.
currently at.
Well,
That's
they
not
wouldn't be able to move because they don't have the resources to move.
right, right. So it's just, and I hear way too many stories about people having to move to San Diego for the ABI program and the Howard House, and it's like
Yeah.
that's such a, depending on where you're coming from, that's such a big move because it's so
Oh, yeah.
expensive out there, and
Oh, yeah. We're
it's
not
not
moving to
easy.
Texas or Arizona. We're moving to
Right,
San Diego.
right. That's, you're talking about one of the most expensive cities in America. it's
Yeah.
it's
Yeah.
a very hard thing to grasp, I guess, as a professional. I'm trying to like keep it cool, but sometimes it just feels frustrating.
Yeah. I think what we need to do is make inroads with people who can make a difference.
Mhm.
Um, I know I was thinking about, you know, um, we need to create like a foundation of some sort that partners with the universities and different disciplines to have like foundational doctoral programs and whatnot to coordinate like public health. I mean, I see something that would coordinate with public health, that would coordinate with the neuro sciences, like neurology, psychiatry, social work, and like have like an interdisciplinary team funded, researchers or whatever, funded rehab counseling, obviously funded by this foundation so that we can get more information out there.
Right. Yeah, actually, Chuck was telling me Illinois has one of like a big foundation out here for traumatic brain injuries, and
Yeah.
they actually might do, he said, the case management program. So I'm actually looking at maybe finding an occupation in that when I come back, but it's just it's, I mean, like I said, it's so rare to find foundations like that. It's just
Where is
amazing.
that?
In Illinois.
Oh, it's in
I don't know
Chicago,
where.
probably.
Yeah, that's what I figured, probably near the city. I know they have a few different locations
Hmm.
that provides the case management, but I need to look into exactly where.
I know they have a really good rehabilitation program there for electrical injury, actually.
Oh, really? Oh, yeah,
Yeah,
you can mention that there's resources out here.
yeah.
I'll have to look into that further, maybe. If you have any information on that, maybe you
Is
could
that
send
where
it.
you are now?
I'm in Illinois right now. Yeah.
Oh, I didn't
I'm
realize
back
that.
home. Yeah, I came back home. I was getting tired of quarantining by myself out there.
Yeah. Well, let me send you the information for that, because let's see. That's not gonna work there. Let's see. Yeah, it's them. Let's see. Um, it's out of Chicago. It's the lightning strike and electrical injury. Electric Shock Survivor International. Let's see, they have yearly meetings. It says that they are out of North Carolina, but they actually have a lot of the professors are out of Chicago.
Okay. Yeah, I mean,
Let's
they
see.
have some good medical schools out there, so it wouldn't be surprising.
Yeah. Chicago Electrical Trauma Rehabilitation Institute. How's that for a mouthful? Yeah.
Yeah, if you have that information, if you
Let
could
me
just,
just send this to you.
yeah.
If I could find where I am here. Let's see, where's my chat? There we go. There's that.
Perfect. Thank you.
But yeah.
So, just to conclude, I wanted to get maybe your last thoughts about maybe what you want people to know about resources and your last thoughts on that.
I think one of the hardest thing about resources is a lot of them require funding from insurance companies. So if you're working with doctors who don't understand your injury, it's difficult for them to document appropriately to get that funding from insurance companies.
Right.
I mean, I just had a sleep study done by a doctor who doesn't understand brain injury. He understands sleep. He understands sleep apnea. My blood oxygen saturation level got down to 84% and my heart rate got down to 49.
Oh my gosh.
No, my heart rate was 48. My blood saturation level was 84. There you go. And my heart rate would cycle from 48 to 123 while I was sleeping, and my oxygen saturation level would go from 84 in the low 80s all the way up to 100 and then back. And so I need to have an inpatient sleep study where they connect my brain up and, look at my brain waves while I sleep, especially knowing that I have this chronic bleed in my brainstem, which controls your breathing. And the insurance company is refusing it. And my doctor is like, oh, well. And so it's like I have to keep searching out doctors that are willing to put in the legwork. And unfortunately,
Right.
doctors are so overworked to begin with.
Yeah.
Like, you need to, like, part of your case management would be facilitating the insurance process.
Right.
Getting the documentation done, finding a list of doctors who are willing to put in the legwork, but then you don't want to burn them out, so you don't want to refer everyone to them.
Right.
So it's just like, I don't know. What was the question again?
Oh, just your last thoughts
Oh,
about, you know, your traumatic brain injury or just in general.
yeah. I think it's extremely difficult to expect the person living with the brain injury to be their own advocate.
Yes.
Um, I can't tell you, I've been trying to get services for myself for 10 years.
Right.
And it's only been in the last 6 months that I've actually made some headway. And that's because I was my advocate the entire time.
Yeah.
But
Yeah.
I was persistent, even if I wasn't consistent in being persistent, I was persistent. A lot of people live with lived helplessness because they try, nothing works, so they just give up.
Yeah.
It takes a unique brain to not give up, a unique courage and spirit of a person to not give up. And I think if we could somehow channel, I think one of the most important things we can do for people living with brain injury is to help them break through learned helplessness using the principles of authentic happiness that Seligman developed. Because once you feel empowered and recognize that you can make changes, then it really doesn't matter how slow those changes come, you will keep trying to make changes.
Right.
And it's so critical for people to be able to feel empowered in their own treatment decisions in their own life so that they don't give up. Because that's why you see these people who suicide, these football players, or people who've survived gnarly car accidents, or people who've survived ECT. You see them suicide after prolonged trying, nothing's working, no one's helping me, I'm out,
I'm on my own. Yeah.
I'm on my own for too long. So it's not like they're weak. We never ask people if their glass, we always ask people if their glass is half full or if their glass is half empty, but we never ask them how long they've been carrying that glass.
Right.
If you can, yeah, if you carry it around a party, you can put it down on a table or whatever, but you're still carrying it, right? If you carry it for an entire day without the ability to put it down, if you
You get
carry it
tired.
for a week, you
Yeah.
carry it for a year, and so slowly you feel like your life vest is starting to fill with cement.
Right.
And then you have the voices in your head saying, you're a burden on your family, you're a burden on your community, you're a burden, you're a burden, you're a burden. So we need to help people take themselves out of that mindset. I mean, I was fortunate because I already got through the psychiatric part. And so I learned a lot of skills along the way.
Right.
But I have to keep kind of helping my peers learn these skills because they keep trying, for 2 or 3 years, and then they're just like, I've tread water with a slowly filling, life vest full of cement, and it's not that they lost their fight. I give them credit for graduating with honors because it's like, dude,
Right.
I know how hard you tried for as long as you did.
Yeah.
So I don't know. I have a completely different perspective, I guess. But I think if I could do one thing for the brain injury community, it would be to help foster resiliency by helping people recognize the power they have within themselves,
Yeah.
and also to help with the case management and the resources funding and research. Those are my four.
Well, I love that you're still, involved in the community and trying to help in any way you can. I've seen you from the very first time I met you
Yeah.
to now, and it's, I mean, I've even been able to witness that impact that the resources in San Diego have had in your life. And
Yeah.
I mean, it's cool when you can see it in person, and I'm
Yeah.
really happy.
Like,
So yeah,
you guys got me connected with,
I think the ABI program we had hooked you up with.
yeah,
And
ABI program, and you also helped me locate the information for MTS so that I could just print it and take it to my doctor.
the peer mentor program, I think we connected.
Yeah,
you
I
with.
definitely Kirk connects me with them. And so it's like I went from being completely isolated at home by myself to being able to get out and about. And
Right.
so,
I mean, just being able to get out is the empowerment that somebody might need just to start them off.
oh yeah, and having like the reduced fare so that I could get on the trolley and get lost in San Diego with a friend, it's it's more, being able to get out of these four walls is really important. Even now during COVID, I pretend I'm walking my imaginary dog. I know you're not supposed to go out, but I go out in my chair around and do like
Yeah,
loops
that's
around the block,
yeah.
just
What is
looking
your
joy.
exactly and
Yeah.
soak up the sun a little bit.
Yeah, and I wouldn't have really had the courage to do that, I don't think, if
Right.
if I hadn't had access to other resources that were like, yeah, Sarah, this is what you need to do. I knew I needed to do it, but I needed like a little kick in the pants.
You got that self-efficacy that you really needed.
Yeah, yeah.
Well, that's good. Well, thank you so much for talking with me, Sarah.
You
And
bet.
if you would like, I can send you my finished project when it's all done.
I would totally like
I'm
that.
a little nervous, but
Yeah,
I'm excited to be studying this this topic a little bit, more in depth. And
yeah. I'm
if you
really
need
excited
anything,
for you. Oh, thank
thank
you.
you.
I if What are you gonna do with yourself when you finish with school?
So my plan is I'm supposed to graduate in May or in December, and yeah, it's very soon. I'm hoping we are able to get back onto campus before
Yeah,
then.
right?
I'm hearing that they're thinking about, just finishing the year up all online. So no decisions have been made as far as that goes, but I really hope not because I do miss going and seeing, professors in my
Oh,
cohort.
oh yeah.
And the ABI program, I was really, loving being part of, and I only got to do that for a little bit. So
Yeah.
it just stinks. But yeah, afterwards, I'm hoping, well, my plan is to move back to Illinois and try and find something out here within the brain injury community.
Oh yeah. Awesome.
Yeah.
My
So,
my brother lives in Naperville.
oh, really? Very
Yeah.
beautiful area.
Yeah, that's what I've heard.
Yes, it's very nice, and it's a little further outside of the city, so you don't have to worry about all the traffic and stuff. So
Yeah.
that's nice. They got some nice malls too.
Oh, cool.
The
um,
best part.
yeah, that's really cool. I'm gonna put a little, if you need anyone to like help you with a letter of recommendation for your brain injury advocacy, I can write it both as a professional and as a person survivor.
Oh, thank you so much. Yeah, I would be so grateful for that.
Yeah.
Um, maybe we can keep in contact for that. And then I know I've been reaching out to a few people about, I'm still doing the ed tech stuff for ABI, so I'll be in contact with you for that as well.
Oh,
Are
okay.
you going to any of the Zoom classes, or
They
have
have?
you?
I didn't even know they had them.
Yeah, actually, I think you're on my list to contact because I think your email kept debunking. It kept coming back saying it was the wrong email.
Oh,
Yeah, so if you want
yeah,
to,
because I never get their emails.
yeah, it might just be that it's wrong in there. Maybe we have a wrong letter or something. So the,
Here's my personal email.
oh, perfect. Perfect. And I will get that put in so then you can start, if you want to start attending classes. I think they just started last week.
Heck yeah, I'm there.
Yeah, and obviously only a few people can access it, but it's it's a good option to have. So.
Oh yeah, I'm there.
Perfect.
Excuse me.
Oh no, you're okay. Bless you.
Oh, excuse me.
Gesundheit.
Thank you.
But yeah, I can reach out to you maybe closer to graduation date, and if you would be open to it, I would absolutely love that.
Yeah, I know you're not graduating till December, so keep sending me your research and things you're working on so that when I write your letter, I can write one of substance.
Right, up to date.
Yeah. And you can send me your little summaries of if you could send me your summary at ABI and your summary from last semester at the San Diego Brain Injury Foundation, then I can write it like a knowledgeable professor would instead of just hey, she's cool.
Okay, perfect, Sarah. Thank you so much.
You bet.
I will get you on the email list serve, and hopefully you start receiving those soon.
Okay, sounds good.
Have a good rest of your day.
Thank you, you too. Say hi to Illinois for me.
Oh, yes. And if you could send me the recording.
Oh yeah, I will figure that out right now.
Okay, it should just email it to you.
Yeah, I will it's going directly to my out whatever it's called. My this thing. My external drive. So but it should pop up. I put in the sorry, I'm getting tired. I put in the settings that I wanted it to send me where it's being saved. So you'll probably get a message from WeTransfer.
Okay.
Because that's the really only way to send it.
Okay, yeah, that's okay. Yeah. Okay. I'll let you go. Go get some rest.
Okay. Take care.
Thank you so much.
You bet.
Bye.
Bye.